Tyson's been complaining of lower back pain when he's training, in particular when he hinges. So anything where he's doing RDLs, deadlifts, or even bent over rows. And this kind of lower back issue can be kind of like a bit of a pump, but also a bit of a sharp pain. So we had a look at him today in clinic, and we had a good look at the assessment first of all, and we found that he had a few things that we wanted to change, but nothing too crazy. Left glute max, left glute med definitely needs to get a little bit stronger. We found that right QL was very sensitized, as is the L4 facets, particularly on the right side. And we found that the motion at his thoracic definitely needs to change. But overall, there's nothing really there that's screaming out at me. So we had a look at, obviously, the things that are really aggravating him. So we had a look at the hinge. And what we found in particular is that when he does hinge, he lets himself drop without really emphasizing the hamstrings, lowering him down. And when he gets to a certain point, he ends up losing the lower back. So he drops into lumbar spine flexion. And what this does is obviously just loads up the lumbar when he does bend forward and the erectors and so forth. And he ends up coming away with a bit of like a muscular pump. So it's working much harder than what it is. What we need to do is just basically, to get to the bottom of this, we're gonna just teach him how to hinge properly, find the limit, load up those hamstrings, and then trying to get him to stop going through that lumbar flexion as much. That in itself is going to stop overloading that lower back and stop that tissue becoming so sensitized. So that's how we're going to kind of like build him up there. So one of the exercises in particular, we've got him on the 45-degree machine over there, and we're just teaching him how to load the hamstrings as he goes into this position and to recruit the glutes and hamstrings to come back up. And then we're going to supplement that with a little bit of tissue work to try and calm everything down.